Indications for medication for bronchoconstriction. Medical directive. Indications: 1. Respiratory distress. 2. Suspected bronchoconstriction. Conditions for salbutamol for bronchoconstriction. None. Contraindications for salbutamol for bronchoconstriction. A is to salbutamol. Dose of salbutamol for bronchoconstriction. If under 25 kg, give 600 mcg of salbutamol via 6 puffs from MDI with spacer or 2.5 mg via nebulizer. If 25 kg and over, give 800 mcg of salbutamol via 8 puffs from MDI or 5 mg via nebulizer. Max doses 3. Interval 5 to 15 minutes, 4 breaths between puffs. Conditions for epinephrine for bronchoconstriction. 1. BVM ventilation required. 2. History of asthma. Contraindications for epinephrine for bronchoconstriction. A is to epinephrine. Dose of epinephrine for bronchoconstriction. Via IM, give 0.01 mg per kg up to 0.5 mg, round to nearest 0.05 mg. Max dose 1. Conditions for dexamethasone for bronchoconstriction. 1. History of asthma. OR2 COPD. OR3 20-pack a year smoker. Contraindications for dexamethasone for bronchoconstriction. 1. A is to steroids. 2. Currently on PO or parenteral steroids. Dose of dexamethasone for bronchoconstriction. Via IM 0.5 mg per kg up to 8 mg. Max dose 1. What is the only thing you can give more than once during bronchoconstriction? Only salbutamol can be given multiple times. Epi and Dex can only be given one time. What medications do you give for moderate to severe allergic reaction? You may give epinephrine and diphenhydramine. What are indications to give meds for moderate to severe allergy? Indications: 1. Exposure to probable allergen. 2. Signs and symptoms of moderate to severe allergic reaction including anaphylaxis. Condition to give epinephrine under allergy protocol. For anaphylaxis only. Contraindication for epinephrine for anaphylaxis. As to epinephrine. Dose route of epinephrine for anaphylaxis. Via IM, give 0.01 mg per kg up to 0.5 mg, rounding to nearest 0.05 mg. Max doses 2. Interval 5 minutes. Condition to give diphenhydramine. Must be 25 kg or over. Mean girls are skinny. Contraindication for diphenhydramine for allergy anaphylaxis. As to diphenhydramine. Dosing for diphenhydramine for anaphylaxis. Via IM for weight 25 kg 49 kg, give 25 mg for weight 50 kg up, give 50 mg. Max doses 1. Medications for croup. Nebulized racemic epinephrine PO dexamethasone. Indications for medications for croup. 1. Upper respiratory tract infection. 2. Barking cough. Conditions for racemic epinephrine for croup. 1. 6 months old to 7 years old. 2. HR less than 200 bpm. 3. Stridor at rest. Kid in bed. Heart on table. Stridor at rest. Ray shirt. Contraindications for epi for croup. A is to epinephrine. Dose of epi for croup. Via NEP, under 10 kg give 2.5 mg 10 kg and over give 5 mg one dose only. Conditions for dexamethasone for croup. 1. 6 months old to 7 years. 2. Unaltered. 3. Mild, moderate and severe croup. Contraindications for dexamethasone for croup. 1. Allergy or sensitivity to steroids. 2. Steroids rect watt per inch last 48 hours. 3. Can tolerate oral meds. Dose of dexamethasone for croup. Via PO 0.5 mg per kg up to 8 mg one dose only. How many joules do you deliver to children for defibrillation? State ages and amounts. 7 years and under for first shock use 2 J per kg. For subsequent shocks use 4 J per kg. Only shock 2 times at most. For previous question, when do you shock only once? When might you shock more than once? If trauma, shock once and go. If medical correctable cause, shock once and go. Only when it's a medical arrest but doesn't qualify for one shock and go can you shock more than once. If anaphylaxis caused a medical cardiac arrest, how many doses of epi can you give? 1 dose of epi. If someone is having a medical cardiac arrest due to opioid toxicity, what meds do you give? You do not give naloxone. How many times do you analyze and shock a trauma arrest? 1 time only. Which situations in medical arrest do you only shock once for? What kind of injury can you never TOR in a trauma regardless of presentation condition? You can never TOR someone with a penetrating trauma to torso or head neck if the LTH is under 30 minutes away. What are the contraindications for TORing someone who has a trauma arrest? You cannot TOR 1. Under 16 to shock them. 3. Signs of life since extrication. 4. PN closes hospital under 30 minutes. 5. Penetrating trauma to torso, head or neck and LTH under 30 minutes. What medications are given for cardiac ischemia? ASA and nitroglycerin. What are the indications to give medication for cardiac ischemia? Suspected cardiac ischemia. Conditions to give ASA for suspected cardiac ischemia? 18 years and older, unaltered LOC, able to chew and swallow. Contraindication for ASA for cardiac ischemia? 1. AS to NSAID. 2. If asthmatic, no HX. If ASA. 3. Current active bleed. 4. CVA or TBI in last 24 hours. ASA dose 162 mg PO. Chew it up into a fine paste and swallow. Max dose 1. Conditions to give nitroglycerin for cardiac ischemia? 1. 18 years and older. 2. Unaltered. 3. HR is 60-159. 4. Normotension. 5. HX if nitro OR. 4. Access obtained. Contraindications for nitro for cardiac ischemia? 1. AS to nitrates. 2. Phosphodiesterase inhibitor in last 48 hours. 3. SBP drops by 1/3. 4. 12 lead shows RVME. How do you dose nitro for cardiac ischemia? Depends on STEMI. If STEMI, give up to 3 doses of 0.4 mg SL. If STEMI is a RVI, give no nitro. If no STEMI, give up to 6 doses of 0.4 mg SL. Dosing interval 5 minutes. What do you do after giving ASA for cardiac ischemia? 12 lead analysis and determine if STEMI What do you do after 12-lead analysis in cardiac ischemia? If there is a STEMI, put pads on. What do you do after 12-lead analysis and you have pads on? Give nitro. What treatments do you give for AIP? For acute cardiogenic pulmonary edema, give nitro and/or CPAP. What are indications for nitro for AIP? 1. Moderate to severe respiratory distress and 2. Suspected AIP. What condition to give nitro for AIP? 1. 18 and up to HR 60-159-3 normotension. What contraindication to give nitro for AIP? 1. A is to nitrates 2 phosphodiesterase inhibitor in last 48 hours 3. SBP drops by a January 3rd after first dose. What are the 3 situations where you can give nitro dose for each? 1. BP 100-139/4 or HX yes then give equals greater than 0.4 mg x 6 doses. 2. BP 140+/4 or HX no then give equals greater than 0.4 mg x 6 doses. 3. BP 140+/4 or HX yes then give equals greater than 0.8 mg x 6 doses. When do you do 12-lead with AIP? Nitro first, then 12-lead. What tells you that a child of 24 months and higher has hypoglycemia? Child of 24 months and up has hypoglycemia if BGL is under 4. What tells you that a child of 23 months and less has hypoglycemia? 23 months and under. If the BGL is under 3 it is hypoglycemic. For which child is a BGL of 3.5 a reading of hypoglycemia? A reading of 3.5 for a child of 24 months and older is hypoglycemic. It has to be under 3 to be hypoglycemic for the baby. It has to be over 4 to be normal for the child. What do you give for hypoglycemia? Give complex carbs or dextrose or glucagon. What are indications to give meds for hypoglycemia? Suspected hypoglycemia. What conditions to give dextrose for hypoglycemia? 1 age 2 and up to alter 3 hypoglycemia 1-year-old teeth coming in so don't give sugar. Contraindications for dextrose for hypoglycemia. A is to dextrose. Dose of dextrose for hypoglycemia. Dextrose can be given via 4-10% dextrose concentration dose is 0.2 grams per kilogram. Max dose 5 grams 50% dextrose concentration dose is 0.5 grams per kilogram. Max dose 25 grams dosing interval 10 minutes. Max doses 2. What conditions to give glucagon for hypoglycemia? 1 altered 2 hypoglycemia. Contraindications for glucagon for hypoglycemia. 1. A is to glucagon 2 pheochromocytoma. Dosing of glucagon for hypoglycemia. For 24 kilograms and under, give 0.5 milligrams IM. For 25 kilograms and up, give 1 milligram IM. Interval 20 minutes. Max doses 2. Remember, glue and 2-2 dose levels 20 minutes. 2 max doses. Who can you treat and discharge? When someone who has hypoglycemia. 2. Someone who had a seizure with lots of conditions. Do you do BGC in a VSA patient? No. ACCD to companion doc. It is of no clinical value. If someone is in arrest due to anaphylaxis, should you analyze first or give epi first? ACCD to companion doc. Epinephrine for anaphylaxis should not delay defibrillation. What do you want the SPO2 and ETCO2 of a ROS patient to be at? SPO2 of 94 to 98%, ETCO2 of 30-40 mmHg. What drugs do you use to treat opioid toxicity and withdrawal? Naloxone, buprenorphine, naloxone. What indication for treatment for opioid toxicity? Suspected opioid toxicity. Conditions for naloxone for opioid toxicity. 1 over 24 hours old, 2 alter 3 under 10 breaths min for inability to adequately ventilate or persistent need to assist ventilations. Contraindications for naloxone. AS to naloxone. Dosing for naloxone. Route IM for dose 0.4 mg, route in dose 2 to 4 mg, route SC dose 0.8 mg, interval 5 minutes, doses 3. Conditions for buprenorphine naloxone for opioid toxicity. 1. 16 and older, 2 unaltered, 3 just received naloxone for current episode, and 4 exhibiting acute withdrawal. W. A COUS score of 8 and under. Contraindications for BN. AS to buprenorphine taken methadone in past 72 hours. Dosing of BN. PO first dose equals 16 mg, subsequent dose equals 8 mg, doses, that's it. Interval 10 minutes. What is the most important thing to take care of an overdose? Upfront aggressive management of the airway is paramount and the initial priority. What are the indications for treatment under the suspected adrenal crisis medical directive? A patient with 1. primary adrenal failure, 2. who is experiencing clinical signs of an adrenal crisis. Conditions to give hydrocortisone. 1. Paramedic presented with vial of hydrocortisone for the identified patient and hypoglycemia, hypotension, tachycardia, temperature 38 or over, altered LOA, syncope, GI symptoms. Contraindications to hydrocortisone. AS to hydrocortisone. Treatment W. Hydrocortisone. IM 2 mg per kg, max dose 100 mg, one dose only. When I was 2, I like to hot and count to 100. What is indication to treat for nausea or vomiting? Nausea or vomiting. What are nausea and vomiting drugs and alternate names? Ondansetron, PO, dimenhydrinate, IM. Conditions to give ondansetron. 25 kg and higher, unaltered. Contraindications for ondansetron. AS to ondansetron, long QT interval, apomorphine use. Dose for ondansetron 4 mg PO. Who to give ondansetron to? NV caused by drug interactions, head trauma, taking diphenhydramine, anticholinergics or tricyclic antidepressants. Elderly patients remember Betty White with a head injury, green, smoking weed. Conditions for dimenhydrinate. Under 65, 25 kg and up, unaltered. Contraindications for dimenhydrinate. Aestinate or other antihistamines, overdose of antihistamines, anticholinergic, tricyclic antidepressants, co-admin with Benadryl, diphenhydramine. Dose of dimenhydrinate. Two options. 1. 25 kg 49 kg equals 25 mg IM. 2. 50 kg up equals 50 mg IM. Max dose 1. When can you give both dimenhydrinate and ondansetron? If patient received one and there is no relief for 30 minutes, you can consider the other. Who to give dimenhydrinate to? Nate at the CNE, motion sickness, vertigo, upset stomach from food injection, pregnant folk, people on SSRIs. What are indications for treatment per the analgesia medical directive? Pain. Conditions to give acetaminophen? Must be 12 and up and unaltered. What are contraindications for acetaminophen? Cannot 1 have had it in last 4 hours. 2 AS to acetaminophen. 3 have HX if liver disease. 4 have active vomiting. 5 can tolerate oral meds. 6 have suspected ischemic chest pain, specifically heart pain. BC then you should start following cardiac ischemia directive. Dose of acetaminophen. Two options. 1. For 12 to 17 greater than PO 500 to 650 mg x1. 2 for 18 plus greater than PO 960 1000 mg x1. Conditions for ibuprofen. 12 and over and unaltered. Contraindications for ibuprofen. Dose for ibuprofen. PO 400 mg x1. Indications for ketorolac. 1. 12 and up. 2 unaltered. 3 normotension. Contraindications for ketorolac. Dose of ketorolac. IM for 10 to 15 mg x1 dose. Names for acetaminophen. Tylenol, Excedrin, Sudafed, Mucinex. Names for ibuprofen. Advil, Motrin. Names for ketorolac. Toradol. Are acetaminophen, ibuprofen and ketorolac NSAIDs? Acetaminophen is not an NSAID. Ibuprofen is an NSAID. Ketorolac is an NSAID. If they are unconscious but known to stimuli, is it ABC or CAB? ABC. If it is one shock and go, do you do another analyze and shock in the ambience? No. If it is one shock and go, you only do CPR in van. Contraindications for SGA. Contraindications for SGA. Contraindications for SGA. 1. Foreign body obstruction. 2. Esophageal varices. 3. Oropharyngeal trauma. 4. Caustic ingestion. Name of drugs for bronchoconstriction. Drugs for bronchoconstriction. 1. Salbutamol. 2. Epinephrine. 3. Dexamethasone. Indications for medication for bronchoconstriction medical directive. Indications. 1. Respiratory distress. 2. Suspected bronchoconstriction. Conditions for salbutamol for bronchoconstriction. None. Contraindications for salbutamol for bronchoconstriction. A is to salbutamol. Dose of salbutamol for bronchoconstriction. If under 25 kilograms, give 600 mcg of salbutamol via 6 puffs from MDI with spacer or 2.5 mg via nebulizer. If 25 kilograms and over, give 800 mcg of salbutamol via 8 puffs from MDI or 5 mg via nebulizer. Max doses 3 interval 5 to 15 minutes 4 breaths between puffs. Conditions for epinephrine for bronchoconstriction. 1. BVM ventilation required. 2. History of asthma. Contraindications for epinephrine for bronchoconstriction. AS2 epinephrine. Dose of epinephrine for bronchoconstriction. Via IM, give 0.01 mg per kg up to 0.5 mg, round to nearest 0.05 mg max dose. 1. Conditions for dexamethasone for bronchoconstriction. 1. History of asthma or2 COPD or 3 20-pack a year smoker. Contraindications for dexamethasone for bronchoconstriction. 1. AS2 steroids. 2. Currently on PO or parenteral steroids. Dose of dexamethasone for bronchoconstriction. Via IM 0.5 mg per kg up to 8 mg max dose. 1. What is the only thing you can give more than once during bronchoconstriction? Only salbutamol can be given multiple times. Epi and Dex can only be given one time. What medications do you give for moderate to severe allergic reaction? You may give epinephrine and diphenhydramine. What are indications to give meds for moderate to severe allergy? Indications: 1. Exposure to probable allergen. 2. Signs and